Engaging in physical activity is crucial at any age, but today we'll focus on 8 essential exercises to combat aging. Stick with us until the end, as the fourth exercise is particularly significant. As we grow older, our bodies undergo changes that extend beyond wrinkles and gray hair. Aging affects every cell, tissue, and organ, especially our muscles. Though aging is a natural and complex process that varies individually, it generally leads to various negative effects on the body. To counteract these effects, we recommend incorporating these 8 anti-aging exercises into your routine. 1. Squat. The squat is the most important exercise for all ages. Besides making the legs strong, it assists in basic daily tasks. When you go to use the bathroom, for instance, you're doing a squat. When you get into a car, that's a squat. Each time you sit down or stand up, that's a squat. If you don't do them well, it will affect the way you live. The squat strengthens all the muscle groups of the legs, including calves, quadriceps, hamstrings, and glutes, as well as the muscles of the lower back and core. These muscles provide the foundation for most daily activities. To do a squat, you should stand with your feet shoulder-width apart. The toes can be pointed forward or slightly out. Engage your core, bend your hips, and sit down as you would if you were sitting in a chair. As you sit down, keep your chest up and your core engaged. As you stand up, place equal weight on both legs, ensuring that the heels remain on the ground at all times. It's important to note whether your knees are in line with your toes and that they don't go beyond your toes and don't move inward throughout the exercise. 2. Plank. The plank primarily targets the core muscles, including the abdominals, back, and hips, but also involves the arms, shoulders, and legs. This exercise can also improve core strength, stability, and balance, which can help older people maintain good posture and reduce the risk of falls. However, older people with limited mobility or balance issues may require modifications or alternative exercises. It's important to consult a doctor before starting any new exercise program, especially if you have any health issues or a history of injuries. There are various benefits to doing the plank, but the main ones are: plank exercises improve balance and stability and help build a stronger core. Many people have impaired balance and increased risk of falls. The plank helps to strengthen the muscles that support balance, such as the core and oblique muscles, as well as the leg and thigh muscles. This can help reduce the risk of falls and improve overall stability for our patients. A plank exercise helps to prevent back pain because it targets the core muscle groups. The plank is a great exercise to strengthen the back muscles, which can help prevent or relieve pain, not to mention it helps to improve posture. The plank can help improve mobility and everyday movements. Planks can help enhance mobility by strengthening the muscles that support the joints, including hips, knees, and ankles. This can help reduce the risk of injuries and make daily activities such as walking and climbing stairs easier. Planks can be modified to fit into an exercise routine for various fitness levels. The plank can be modified in several ways, making it an accessible exercise for people of all ages and abilities. For example, if you have a wrist injury, you can use the forearm plank position, or if you feel more comfortable, you can perform in a high plank position with your hands. If you are a beginner, you might also want to start with a modified plank using your knees or on an elevated surface. It's a low-impact exercise. The plank is one of the best low-impact bodyweight exercises that puts minimal stress on the joints, making it a great option for those with arthritis or other joint issues. It can also be performed in various environments, such as at home, in the gym, or in the backyard, and does not require equipment. 3. Push-up. Push-ups are one of the best exercises for strengthening the upper body. More specifically, push-ups strengthen the chest, shoulder, arm, and core muscles. Unfortunately, push-ups are not the easiest exercise to perform. 4. Lunge. Like the squat, the lunge is a compound movement, meaning that 2 or more major muscle groups are worked during the exercise. In the case of the lunge, the quadriceps, glutes, and hamstrings are being worked. When the torso is kept more upright during the movement, most of the tension will be on the quadriceps, the front part of the leg. If you lean the torso more forward during the movement, the tension shifts more to the glutes and hamstrings, the back part of the upper leg. Moreover, the lunge is also a unilateral movement because you work one limb at a time. 5. Glute bridge. The glute bridge exercise is good for you at any age, but it's especially beneficial for older people. This is because it helps keep muscles healthy. According to various studies, older adults can also benefit from practicing a moderate amount of physical activity every day. Strength training, in particular, has many advantages, and one exercise that can help you with age is the glute bridge or pelvic lift. The pelvic lift is a beneficial exercise for the glutes because it involves the gluteus maximus. Your glutes help you in many daily activities, such as walking and climbing stairs. But the advantages of having strong glutes aren't limited to what you can do with your legs. You also use your glutes in many other day-to-day activities. Strong glutes also lead to a firmer core, which helps strengthen your back and knees. Furthermore, by doing weighted hip lifts, you strengthen these muscles over time. The strength and mobility you gain from this specific exercise will be noticeable in everyday life, so it's important to do the weighted hip lifts correctly to avoid injuries and make progress. 6. Burpee. Older adults can do the same exercises as us, just with modifications. Great exercises for compounds that work the entire body are burpees. Burpees are a great activity to show progress and showcase your ability. Burpees can be tough, especially if you've never done them before, but if you do burpees every day, even just a few, you'll be strengthening up like a pro in no time regardless of your age. The burpee is a simple but effective tool for a total body workout. It's a great way to work most of the major muscle groups of the body to efficiently strengthen both the upper and lower body. Even the extremities, like the hands, get a workout. Burpees are great because they work shoulders, arms, core, glutes, quadriceps, and hamstrings, practically a whole body workout. Burpees are an excellent exercise to help you get in shape quickly. To start doing burpees, you should stand with your arms at your side. Squat down until your hands reach the ground. Jump and push your legs back. Upon landing, you should be in the plank position. Hold the plank for a moment and check your form is correct. Jump your feet back to your hands. If you want to make the burpee more challenging, add a push-up before bringing your feet back to your hands. Jump and extend your arms over your head as you rise, land standing up, and repeat the exercise as many times as you can. 7. Walking. Walking brings many benefits to all people. It can improve your health and well-being in various ways and can help you live independently for longer. Walking can strengthen your muscles, helps to keep your weight stable, reduces the risk of heart disease, stroke, colon cancer, and diabetes, strengthens bones, and prevents osteoporosis and osteoarthritis, helps to reduce blood pressure in some people with hypertension, improves your balance and coordination, and decreases the likelihood of falling, keeps your joints flexible, increases your confidence and mood, and helps you feel better in every aspect, improves your energy levels, and increases your endurance, improves your social life. Walking is a great way to get out and meet people or socialize with your friends, reduce anxiety or depression. You could choose to walk at a steady pace for longer periods or in shorter, faster bursts, or up and down steep streets or stairs. Everything helps. To get started, it's important that you wear the correct shoes for walking. Comfortable sneakers work well for most people. If they're new shoes, try them out first to make sure they fit well and are comfortable. The main benefits of walking are: improves heart health. Studies have repeatedly shown that walking can help improve circulation and blood pressure. Walking is one of the best exercises for heart health. Various research recommends walking at least 150 minutes per week for adults 65 years or older. Reduces blood sugar. It has been shown that taking a walk after meals, even if it's just a 15-minute walk, reduces the increase in blood sugar that some older adults may experience after eating. This study found that walking for half an hour played a central role in preventing long-term complications in the treatment of type 2 diabetes. Blood sugar reaches its highest level between 60 and 90 minutes after eating, so it's best to do your walk within this time frame. This is important for older people with prediabetes or other types of diabetes who are looking to avoid dramatic swings in blood sugar. Stronger bones, joints, and muscles. Walking offers benefits for bones, joints, and muscles all at once. When you walk, you work various muscle groups, including quadriceps, hamstrings, calves, ankles, glutes, lower back, and abs. Try swinging your arms while walking, and you'll see benefits in the upper body as well. The movements of walking help strengthen the supporting muscles and bones at the same time. Walking helps keep the joints lubricated, which is very important for older people. This can help stay more independent and prevent injuries like hip fractures. Slows cognitive decline. Walking can help people stay mentally sharp as they age. Studies show that walking can help protect the aging brain from dementia and Alzheimer's disease. It has been shown that age-related memory decline was less in those who walked more. This study found that the most active participants had a 20% lower risk of cognitive impairment than those who were inactive. Another study suggests that approximately 2 to 4 hours per week of walking can improve cognitive function in healthy older adults. The same study also showed that walking stabilized cognitive functioning in Alzheimer's disease over 1 year. If you've made it this far, I'm sure you liked the video. Here's the thing, have you been training for a while and your muscles don't seem to be developing? I've prepared a guide to get you out of this situation and gain muscle up to 3 times faster. The link to this guide is in the description and in the first comment attached. 8. Dead bugs. This exercise is a great way to target the core with low impact without overloading the body and its joints. This exercise is simple. Just lie on your back so that your shoulders and lower back are supported on the ground. After that, raise your hands above your shoulders. Next, lift your legs and bend your knees with the knees over the hips at a 90 degrees angle. Engaging the core, exhale while slowly lowering the opposite arm and leg, left leg and right arm. Return to the starting position. Repeat on both sides and do a total of 10 repetitions on each side. Which of these anti-aging exercises do you do every day in your workouts? Tell us here in the comments below.